Good afternoon, everyone. My name is Adam Del Molino, and I am the Senior Director of Virtual Care and Clinical Affairs here at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Navigating Rural Health Transformation Program, RHTP Compliance, a practical guide for hospitals and health systems. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2026 annual sponsors and strategic partners for their support in underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like the implementation of the RHTP. I'm pleased to introduce our speakers from Forvis Mazars today. Ryan O'Grady is Director of Healthcare, and Darshana Shyamsunder is Senior Manager of Grants Management Services. Thank you both so much for being here today, and we're really looking forward to today's discussion. I will now hand it over to Ryan to get us started.
Thanks, Adam. I just want to quickly introduce myself, and I'll hand things off to Darshana. As Adam mentioned, I'm an insurance director in our healthcare practice at Forvis Mazars. We've got about 15 years of experience working with healthcare providers across the country, anywhere from large academic medical centers to community hospitals and behavioral health providers. So for today, I'm going to spend a lot of my time talking about the single audit compliance, and getting policies and procedures together, and readiness for that upcoming single audit on the Rural Health Transformation Programs. I work with organizations that receive anywhere from one grant every few years that needs a single audit, to organizations that have a single audit every year with a CFA of 50 to $60 million. So a pretty wide variety of organizations that are familiar or not familiar with single audits, and hope to share some good information for you all to take away here to prepare for that upcoming audit. Darshana?
Thank you, Ryan. I'm Darshana Shamsunder. As Adam mentioned, I am part of the Forvis Mazars team here in the grants management services. My job basically is working with anybody that gets a federal grant, right? Starting right from pre-award, where we sometimes help them write the grant, to post-award management, because all the compliance, we all know for people who have received federal grants, there's so much compliance that we need to follow, and that's where we come in and we help. Before Ryan walks in to audit, we make sure that you are prepared and have all your documentation in row, so that when an auditor walks in, you have everything you need. So we help organizations like yours right from pre-award to manage the grants as they come in. We'll get started on the presentation now. So thank you so much for joining us today as we talk about this topic. I'm sure this is your 101 times you're listening to something related to RHTP. But today our goal is to spend time looking at, again, a quick overview about the Massachusetts program, and then what are the compliance elements that go along with it, and then single audit. And what can you do right now while you're waiting to be prepared for this funding? So you already met Ryan and me. Moving on to the next slide. Before we go further, we have to do a legal disclaimer. This presentation is not legal advice. What we are sharing today reflects program guidance and compliance considerations based on experience working with federal funding programs. Your organization should always rely on your internal legal counsel or compliance leadership for advice specific to your circumstances. The agenda for today is basically going to be, we'll talk about, as I said, the RHTP program in general, but then drilling down to Massachusetts program, understanding what those initiatives are. And then we shift gear into how can you prepare for that funding? What can you do right now? And then we'll talk about compliance, because setting it up on the forefront properly will just help prevent any clawbacks later. And then finally, Ryan will walk us through all the single audit requirements and considerations that are required with this funding. So let's get in. Before I get into the details, one of the things that we really want to level set with this program is that this is not your traditional one-time grant funding, right? It is really designed around transformation over time. With half of each year's pool is divided equally among all approved states, and the other half is allocated based on how each state's application addresses CMS's strategic goals. So what we want hospitals to think about it is that this is not like, hey, we can just do this again. No, it changes how you approach the planning and execution of this grant because it is intended to be transformation. So let's just start with the basic federal framework, right? So the One Big Beautiful Bill Act, the Office of Rural Health Transformation, which is within the CMS, has committed 50 billion over 5 years, 10 billion each year that'll be given out. All states got their first round of funding for year one. What are the eligible uses? The eligible uses basically is a wide range: preventive care, provider payments, reimbursement for rural health, telehealth, IT infrastructure, mental health and substance abuse, training, technical assistance, a lot of these things. They're all written down. But the common thread is transformation. Projects are intended to improve access, coordination, and outcomes in rural communities. These dollars are intended to support initiatives that may not have otherwise moved forward, but there is accountability built into them because a big part of this funding is the measurement. So let's look at Massachusetts in focus on Massachusetts funding, right? So CMS will now flow the money to Massachusetts. They have received their year one funding. And then what the Executive Office of Health and Human Services will then work with providers in the state through maybe sub-awards, contracts, partnerships, grants, a variety of ways that they might get this funding out, right? So providers might participate as subrecipients or contractors, depending on how each initiative is structured. And that's going to drive the entire compliance footprint. So you want to think about that. And we'll talk about it a lot more as we move ahead. But three overarching goals that frame the application are: they want to ensure rural residents can readily access healthcare services. They want to generate opportunities to improve their health and well-being and scale systems, policies, and investments to meet the unique needs of rural communities. So right now, the Department of Executive Office is really working with people and advisory groups, work groups, and outreach just to understand, hey, what's happening? What do you need? How is this going to support our community? But really, no procurement has been released yet for Massachusetts. This slide lists all the 7 initiatives that Massachusetts wrote down in their RHTP application. I won't go in detail for each one of them because it's a lot to read, right? So what I wanted you to look at that the headline, the projected outcome is a measurable reduction in emergency department utilization per 100,000 in targeted rural communities. That's like the projected outcome. So the first thing I would want you to consider is go and read the application and see where your organization fits in here and which initiative actually matches the program you're thinking about. Now that we understand Massachusetts and the RHTP, and there's a lot there to understand and read, we want to shift from program context to preparation, right? So what can hospitals do now to support readiness for the RHTP funding? This is actually the stage where we've seen the biggest difference between strong and weak applications, right? The organizations that tend to prepare early move faster when the state award is released. And they are far more credible because they have taken the time to get everything all the documentation in line. And while we know that nothing is out yet for Massachusetts, what we are seeing in other states is that there's a wait, and then rush, rush, rush. So when the application comes out, you have 30 days to apply. That's it. And then in 30 that some states have done that. So in 30 days, you need to get all this documentation together. So right now would be the time to think through those and see what matters to your organization and get some of that documentation ready. We wanted we thought it would be helpful to anchor this conversation in the grant life cycle, right? So the pre-award stage, the award state, and then the post-award. So pre-award is when a lot of the heavy thinking is happening, and that's what we're talking about right now, right? So research on Massachusetts 7 initiatives. How does it align with the CMS priorities? And then the application narrative, like honestly, how does it fit your organization, and then the budget, right, that will go along with that proposal. And most of the times you've seen that these budgets take the longest to prepare and they kind of make or break the proposal, right? So thinking through all of that, and it's the heavy thinking phase, we call it, is thinking through that now so that you're ready. Then the award phase is when the award acceptance happens, right? You then know what is the guidance? What do we need to do? How do Now you've outlined everything so you can set up your project plan so you can launch cleanly. And post award is basically when all the real work technically happens, right? So implementation, reporting to the system, documentation, subrecipient monitoring, if that's applicable to you. What you want to think about right now is that though Massachusetts is in the pre-award stage, and you are also in the pre-award stage because there's nothing for you to really apply to right now. This is the time to prepare so that it reduces friction later. And then the post-award compliance and reporting will just be easier because you've thought through those things. On this slide, we really wanted to talk through the roles because they affect how hospitals structure their partnership and their internal ownership, right? The funding typically flows from the awarding agency, in this case CMS, to the recipient, Massachusetts state, and then from that to subrecipients. Now, depending on what you're categorized on your grant application, a subrecipient or a contractor, that will define some of the compliance. And I know Ryan will talk more about that when he gets to slides. But what we've really seen as the applications that are likely to perform best are the ones that can demonstrate measurable rural impact, partnership across counties or providers, sustainability after the grant funding ends, and clear operational outcomes. And that's all built into the application. So you want to think about that right now as you're thinking through that narrative. The state would also really want to focus on who can launch quickly and get this moving and show near-term results so that they can report that back to the feds, right? So that's going to also play a role about your capability, about how can you make this happen, what you're saying on paper. And a big part of this is partnership. What we want hospitals to think of or healthcare systems to think of, this is not a one alone, let me go apply grant. It is going to be focused on partnerships and alignments of workflows that is going to then lead to the award. So we encourage hospitals to think through, like identify your strongest and regional partnerships right now. Define one or two measurable access problems you can solve, and then frame those projects around sustainability and workforce impact, and just not infrastructure alone, right? So that way is you'll be consistent with what RHTP is intended for, right? The state wants scalable, data-driven, rural healthcare transformation programs that are not one-time standalone projects. So we want you to start thinking on those lines as you prepare. And so while you wait, what you can do is map your existing rural service footprint across Massachusetts 7 initiatives. Identify which of your project will clearly advance what data you have to support, and you have the data to support that need, right? A lot of times, that program data is what you need to apply for, and you need that in your application. So just getting all of that together Then all your supporting documents. Do you have the policies and procedures in place? Do you have all the time and effort records that you would need to keep if you were asking for a staff's salary on there? What are going to be your cost allocation methods? Are you going to be able to document that? And then what are auditors going to look at, and how can we make sure that we clarify that on the front end so that our documentation, our processes, and our procedures all match up and we can easily clarify those priority outcomes, right? And we already talked about partners. Like if you engage your partners right now, early on, then that way you have a solid application to apply for. So while we are preparing for this funding, we also want to think about, hey, what are these reviewers thinking about? What do they expect from our application, right? We all know this is a competitive environment. Though Massachusetts got 162 million for year one, it's going to be divided against seven initiatives and across 700,000 people rural population, right? So each sub award is going to be looked at with scrutiny, right? Like they're going to say, hey, is this going to really meet the goals that we want, that CMS, that we have set on our application to CMS that we're going to achieve? So you want to think through that. Projects must clearly advance both CMS and the state transformation goals. And then alignment and execution capacity, right? As I mentioned this earlier, um, if you want to identify your leadership and your alignment and sustain leadership and staff investment, that's going to go over the full 5-year cycle, right? This is going to be year after year. But once you've thought through that, projects will have to align with organizational strategy and demonstrate that capability to execute, not just to spend, right? It's not a spending grant. But how are you going to make this happen? And then how are you going to show value and impact? And so we would love for you to think about your application almost like a business case. Why should the state fund your project, right? Strong proposals will define rural specific data, name partnerships, and commit to measurable results. And those will basically tie into the Massachusetts program initiatives. That way, the reviewers will look at, hey, this really ties up with what we are looking for, and this project will really clearly make an impact, and it'll be easier for them to approve of that. So some other elements that we thought might help strengthen your application are, first, you want to demonstrate that it is strategic alignment. It's not because a grant came up, that's why we applied. No, this is a time sensitive grant, and also it's an administrative funding is capped, right? So yeah, so the leadership will have to confirm if this project aligns with your organizational strategy and that the expected outcomes, access improvements, or even community impact justify internal investment beyond the grant, because it's going to take a lot of effort. And so we always guide any clients that, hey, you don't want to just apply because the grant came. Does it really match your community needs assessment data? Does it match your strategic plan? And if it is helping you advance that thing, that project that you've been putting on the shelf because you don't have money, this is the time you can transform. And if that transforms access for a rural population, this is the time to think about it and how it aligns. Again, the second is, again, we talked about transformational intent, right? That's a really big thing for this grant. So instead of just saying, hey, we need this equipment, it's going to be like, how is this equipment going to increase access and build lasting capabilities in the rural area you're trying to impact? Leveraging partnerships. And I've talked about partnerships before throughout the presentation, but it's going to be heavily weighed where when a strong partnership is going to show those partnerships and show that they're ready together to make the change that's required and deliver those results, those measurable results. And you want to have partners in there that are going to be able to make that impact with you, right? You want to make sure that you've talked about that, and then this is a reimbursement-based funding. So you'll have to think through that, hey, how are we going to manage this on our end? And how are we going to do it on our end when we have to get this funding out? Only we'll get reimbursement only after we've done the work, right? So, and you cannot, like, just like any other federal grant, you want to remember that costs cannot be incurred before contract execution. So sequencing and readiness will matter. And then finally, plan for sustainability, right? So one of the key items is that they want to see that you can sustain this program after the 5-year funding is gone, right? So define your outcomes, performance measures, and success matrix or criteria, and show how the work continues beyond the grant period. And compliance and reporting are going to be as key, right? Because if you are delayed on your reports, you're delayed on your compliance, that's going to show that you're not able to maintain an operation and won't be sustainable in the future, right? So you want to make sure you have all that thought through and written down. So a few practical ways to think about this is you want to quantify the need using Massachusetts data, right? Like what is rural data? So what is happening right now? Where are the gaps in behavioral health or chronic disease or ED utilization? You want to quantify those. You want to make sure you tie that directly to a Massachusetts initiative and a CMS priority. And then build the budget as a story, right? Every line is connected to an activity that you're performing and with an outcome. And then strong partnership. If it's your FQHCs, your EMS, your other behavioral health centers or community organizations, showing that partnership on your application is going to just make it stronger. And then again, on this slide, we just try to kind of start, like, begin with the end in mind, right? So instead of asking, like, hey, this is what we wanted to do, think about what's allowable, how can we make that happen, and what are the outcomes? And what problem are we trying to solve is a big question that we request healthcare providers to think about when they are trying to answer this, and if this is the right fit for our organization. Is if the answer is that the funding is helping access healthcare in increase the access of healthcare in rural communities, yes, you want to go apply for that. And then the other thing that we tell clients is that don't just try to fit too many small projects into one big application, right? Because they all are small. So don't aggregate your projects. Try to submit a application that clearly outlines or connects with that initiative so that it shows the clear path as to you've thought through it, it really is in alignment, and this is what the outcome is, which ties to the outcome the state is looking for. And then the biggest thing that, takes a lot of time and discussion and lots of meetings to decide, right? The budget. So you want to think through the budget. And I think I mentioned this earlier. You want to make sure that the budget, like the scope drives the budget and not the other way, right? Every line item on that budget is assigned to activity that's going to be performed. And then you want to make sure you include all the details, personnel, fringe, travel, whatever you need in there, just so that it's all outlined clearly. In terms of indirect cost, you want to make sure if you have a negotiated rate with the federal agency, you could use that, or you would use the de minimis rate. So you want to make sure you apply that consistently, and you want to avoid duplicating cost anywhere else. So make sure that the budget aligns with the federal cost principles and program limits and is structured to support your invoicing, your review, and monitoring without rework, right? If there is a match or cost share, make sure you call it out properly, you make sure it's there, and there's a consistent check that your totals reconcile across all sections. So while you're thinking about your budget, we would say start with activities and milestones, then assign your costs to them with short justifications, linking each line to an outcome. Now, you want to call out provider payments, capital, or EMR costs because there are some caps on them. And you want to make sure that you've seen those and read those so that they align with what the state and CMS wants. right? So build in some cushion because indirect will account for some of it, but not all of it. So finally, you don't want to have some lump sum payments in there saying to be determined. You want to show that you've thought through everything and you every activity or initiative there ties to something that you're going to try to achieve or measure. And while you're thinking through the application, we talked a lot about how you can prepare for the application. A lot of readiness also comes from internal. This is almost like a reality check, this slide, right? When you receive that funding, you're going to get into compliance mode right away. And a lot of times the application itself has these questions. We are seeing other states where we're helping clients apply, where they're asking these questions. Do you have a policy in place? Do you what like do you have your procurement in place, right? Like your policy in place. So just thinking through that. Because sometimes if you've not received a big federal grant in the last couple of years, you might have an outdated policy, or you might have a policy that does not really work when you get massive chunks of money. We've had clients that have come out and said that, hey, we had a client that had a policy where it said that every time they spend 100K, they would require three signatures from the C-suite. And if you think about when you're trying to spend couple $1 million within a year, for every 100,000 you spend, if you have to go get signatures, it's going to just delay your procurement. So again, you want to think through, read through your policy, understand that everybody on your staff understands it, right? And make sure they're trained because you might have had staff turnover since the last time the policy was updated. So thinking through that, getting your policies in place, your financial management systems, like can our software system handle tracking federal grants separately? And then the staffing. Do we have enough staffing to manage the federal grant? Because it's going to require all that accounting and reporting. So I'll move on to the next section, grant compliance, right? So given that federal grants have a heightened uh, attention, and especially this one has a lot of attention, and especially in the first year, there's going to be a lot of subrecipient monitoring. And while the state gets monitored, they're also going to be expected to monitor their subrecipients, right? So there's going to be a lot of monitoring happening. And the way this grant has been written, it's a cooperative agreement. And so the CMS plans to have a lot of insight and partnership while this grant is being implemented to the states. So that means it rolls down to the providers as well. So we want you to keep grant compliance in the forefront while you're thinking through this. These are all the areas where compliance applies. And when we say compliance, what we really mean, like if I had to break it down like a third grader, is can you clearly demonstrate after the fact that you use the funds exactly how you said you would? Does your documentation, in Ryan's world and in my world, if you don't have the documentation, that means you never did it. You could have the best of intentions, but the documentation really shows that. So does your documentation show that you said you use the funds exactly the way you said you would? And so these are a couple areas where there is like each of them have different, primarily 2 CFR 200, the uniform guidance. So each of these areas have both federal and maybe some state might have some additional terms and conditions. So you want to first look at your grant agreement when you get that to understand where all and what all is applicable to you. So on this slide, we've written a lot. It's a lot of content. I'm not going to read through all of that because you'll have the slide to look at and read through it. But you want to understand your funds and your fiscal guardrails. What are the costs that are allowable? What is not allowable? What does supplanting mean and duplication and what is prohibited? And then what are the unallowable costs? Are we going to like you don't understand the program in detail and there might be something that comes in there, you want to understand that. And a big part of it is this grant does not support construction, so you want to think about that. And then there are spending caps. There are a lot of spending caps on different items, so you want to think through, are we doing anything that will you know that will break those caps or make us go over limit. You want to think through that. And then the indirect, right? So use your federally approved negotiated rate, or you could use your 10 or 15% de minimis rate. But whatever you do, you want to make sure you clearly calculate it, outline it, so that when you're monitored, you have that documentation. And so the bottom line basically is that you want to tie every dollar to a clear activity and avoid vague or unsupported documentation. So moving on to this, as I said earlier, read your grant agreement. And that's the first thing when we come in and help someone with grant management is that understanding those terms and conditions, maybe building a grants matrix for yourself and saying, okay, these are all the things that we need to follow based on our grant application, both federal and state. And then if you take one practical thing from the slide, always start with your award terms and then look at federal and then state, right? So whichever is the most restrictive, that's what you need to follow, and your policy, right? So thinking of all of that and just making sure that you follow the most restrictive guidance is what's going to keep you out of trouble. So on this slide, we just wanted to talk through a few of the requirements that you can do right now as you're preparing for this. Getting your sam.gov number and registration active. A lot of times you've seen clients who come to us and say, hey, we need help applying for the grant, but their sam.gov is inactive since last 3 years. So now you have to make it, go do that. So, sometimes states have their own application, like you need to go through their own procurement site and they have a different number that you need to have and be active in the state portal. So just make sure you have that. And then understanding what the requirements are going to be. What's the period of performance? What's the indirect cost rate? What are the other elements that are required for us to follow? Just understanding that is going to help you get prepared as you think through this application. So on this slide, we try to list out all the items that might fit the reporting, oversight, and governance. And we've tried to break it down into 5 basic areas, right? So budgeting and procurement discipline, right? Using your detailed line item budget, following those federal thresholds, understanding those federal thresholds, and making sure staff is trained. Your finance team might know all those, but then the program staff implementing those things in the department does not know. So just making sure everybody's trained on those. And then the documentation, documenting conflict checks, getting quotes when required, just having all that paperwork and you have built a system around it so that you have all of that aligned as needed. Cash management, just drawing funds as you need. Again, we talked about this being a reimbursement-based grant funding. So you will have to show the documentation and then do drawdowns once you spend that money, right? And then reporting and transparency. You will have to submit reports quarterly, and then that is what is going to get fed by the state to CMS. So they're going to be looking at this. This is a very high measurable grant. So they want to look at all that reporting and all those combined numbers and the impact they're making. So just make sure that your program staff knows that they have to get those numbers to you. It's reported timely in your system so that when it's time for report, you're not scrambling to data entry. And I know audit and monitoring. So if, as I said, this is the state will monitor, the CMS will monitor the state and the state will monitor their subrecipients. And Ryan will talk all about the single audit, but you want to make sure you track that for yourself and then you maintain records for at least 3 to 5 years based on what the grant application agreement says. And then there are certain areas within the grant guidance that you need prior approvals and workforce conditions and requirements that you need to build in. So just think through that and read through that so that you know what you're committing to. And then whenever you have those prior approvals, you can go request them in a timely fashion. Again, on reporting, we just wanted to list out the different kinds of reports that you will be expected to be doing. Just there'll be quarterly and annual progress reports. There'll be the SF425, and maybe that's what the state might do, but they might need your input for it. And then, so these are, and the FAFTA, if you're used to that, you'll have to report on that as well if you get to that. So these are all the reporting that you'll have to keep in mind. So just thinking through that so that you build that in your timeline and you have the data to support it. With that, we'll move into the single audit section, and then I'll hand it over to Ryan to take us from here.
Thanks, Darshana. So we've kind of given a good overview of, what is the Rural Health Transformation Program in Massachusetts, kind of some key ideas and thoughts around your application and things to think through, as well as a good overview of just kind of general grant compliance takeaways to make sure you're in compliance with the Rural Health Transformation Program. So a lot of that is pre-award or maybe kind of compliance kind of once you get the award. The single audit is really going to be based off your fiscal year end, but that's going to be where your financial statement auditor will come in and actually test the compliance of those federal grant requirements. Darshana, you can go ahead and go to the next slide. So there may be some organizations that are very familiar with single audits. Maybe you're familiar with federal grants. Maybe you have a single audit every year, but I'm going to have one or two slides maybe as just a refresher for organizations that have never had a single audit, or maybe you haven't had one since provider relief funds a few years back. So maybe you just need a little bit of a refresher. But essentially a single audit is an audit that combines both the financial statement audit and a compliance with federal awards audit. So it's really got two audit opinions that would be issued. The first is really your basic financial statement audit opinion that your financial statements are presented fairly in accordance with GAAP. And then there'll be an additional audit opinion basically on whether or not the organization adhered to the federal cost principles and the related laws and regulations around the major program that was determined to be audited. So when I say major program, if you receive multiple federal grants in a fiscal year, any award that you have over $1 million of federal expenditures in your fiscal year, your auditor will evaluate if that program needs to be tested. So there's some formulas that go along in with how a program gets selected, but I'll just say in the first year, if you receive over $1 million of RHTP funding and you expend that all within your fiscal year, you will have a single audit on the RHTP program funding. So definitely want to prepare for that and get ready for that. If you're familiar with the old threshold used to be 750,000, that was updated back in October of 2025. So that new threshold is $1 million, just if you're not aware of that. But want to make sure we're talking about those updates. But kind of as an additional refresher, it's important to know that materiality in a grants compliance audit is not the same as your financial statement audit. So if you're familiar with your financial statements, you kind of maybe don't know what materiality is, but you have an idea of what is material to your financial statements. The threshold on that might be set at maybe your total assets or your total revenues. In a single audit, in the grant compliance audit, that materiality is going to be set on the expenditures of that major program. So for the RHTP funding, if you were awarded $1 million, we're assessing materiality on $1 million, not on, 50, 100 million, multiple 100 million of assets that your organization has. So the level of scrutiny and maybe smaller dollars items that are looked at in a federal grant audit are going to be a lot more than maybe in your financial statement audit. So that's something to get ready for as well. Really, every dollar that you spend in a single audit matters. Your auditor will likely be looking at invoices that may seem immaterial to you, but in a single audit, that materiality threshold is much less. Darshana, you can go to the next slide. Excuse me. I also want to talk a little bit about, Darshana mentioned kind of the subrecipient versus contractor relationship in grant contracts. So that's really key in determining if you need a single audit. A subrecipient arrangement is really where you're an entity receiving funding and you're actually carrying out the initiatives of the federal program that's related to that contract. So a lot of the RHTP funding that you're going to be receiving from state organizations is going to be a subrecipient type relationship where you're actually, as the healthcare organization, you are carrying out the initiatives of that federal program. However, there can be some contracts made where you're actually just providing a good or service to support the state carrying out that initiative. So the reason that matters is if you're determined to be a subrecipient of that funding, you're subject to all the federal grant compliance requirements, and you're subject to having a single audit. If your contract is determined to just be a contractor relationship and not a subrecipient, then you're not subject to the same federal grant requirements, and you're not required to have a single audit. So if any of that's unclear in your grant contract, it's important to communicate with the granting agency to make sure that that determination has been made. They should have that information available. They're required as the prime recipient to really document that and understand who they have as subrecipients and who they have as contractors. So if you're unsure when you do get awarded funding, please reach out to your granting agency or your service provider, like your auditor, may be able to help identify that as well. But it is very important to understand which contracts will have a single audit and which ones won't. I work with some organizations in other states where they're getting both types of contracts from the state. So they have some contracts where they are a subrecipient, and then they're doing some administrative services for the state related to the RHTP funding where they're a contractor. So they really have to identify the funding sources of both of their contracts and know kind of their compliance requirements on either side. So I think we're going to see a lot of different things in different states, but again, just important to monitor that as well. So the schedule of federal awards, or the CFA that it's called very often, this is a key report in the single audit. So this is a supplemental schedule that will go into your entity's financial statements. It really recaps the federal grant expenditures during your fiscal year. And so I think it's important to say this is based on accrual accounting. So just like your financial statements, but I do often get kind of a draft CFA from clients that is often, after a few questions and answers, I learn it's actually, they've given it to me on the cash basis. So they basically just recapped how much funding in cash they received, not necessarily how they expended it in an accrual accounting. So want to make sure you kind of prepare it that way. This really gives the auditor a picture of all the different sources of federal funding you received, if you received other grants other than the RHTP funding, and helps identify what the major programs are that need to be tested. There could be multiple, sometimes 2, 3, or 4 programs need to be tested in 1 year, depending on how much expenditures you have. But kind of some important aspects of the CFA, wanting to make sure you have the controls in your general ledger to be able to identify not just we have this federal funding, we know which programs they're related to, so that we can properly report them on the single audit. If you do, subsequently identify that there was a federal grant that you received money for that was left off of the CFA, if that was determined to be a major program, you've got some compliance issues that potentially you didn't have a single audit performed on that major program. You may need to go open and restate and reopen a prior period financial statement. That'll likely result in, material weaknesses over internal controls, things like that. So kind of good, solid accounting procedures around how to prepare and report on your CFA is going to be important. And then also kind of just making sure you're communicating with those granting agencies on what the expectations are for which grants need to be reported on the CFA is going to be important. Darshana, you can go to the next slide, please. So a little bit kind of what needs to be reported on the CFA. So each federal grant that you receive is going to be reported based off the assistance listing number, also known as the ALN, used to be called the CFDA number, if you're familiar with that. For the RHTP funding, that's 93.798. So we're going to be listing each program that we receive federal funding by the assistance listing number, how much we received during the year, and then that'll reconcile to our total federal grant expenditures on the CFA. It also lists pass-through agencies. So if you're getting this from the Massachusetts Department of Health or some other state agency, you're going to indicate who you received the funding from, potentially your contract number associated with that award. So that kind of, once all of this is prepared and your single audit's completed, the CFA is uploaded to the Federal Audit Clearinghouse, which notifies the government that you've received the audit, and then all of that additional information, it's going to help notify the state that the grant that they gave you was also included in the single audit. So that's kind of why you're required to include who you received it from, what the funding was from, potentially what the contract number was, et cetera, so that all of these state and federal agencies can reconcile the funding that's been sent out, and that they can check their box that you've had your audit completed. So I'd like to talk a little bit about the compliance supplement. So you may or may not be familiar with the compliance supplement, but I really think this is a good resource for organizations that are undergoing a single audit. This is probably a 2,200 page document that's issued by the OMB every year. It's primarily for us as auditors to utilize in our single audit. I've kind of got a example here of the coronavirus state and local fiscal recovery funds, ALN 21027, kind of just showing what this looks like in the compliance supplement. I don't have the RHTP funding yet to show here as an example, because the compliance supplement gets finalized in the summer of every year. And so the RHTP funding, since that's new funding, does not actually have a finalized document available yet for me to share. But this is kind of a good example for once that is released of how it kind of illustrates what compliance requirements your auditor will test and what compliance requirements they will not test. So each year when this is issued, you can just kind of Control F search the grant that you're looking for. So you can search for the RHTP grant and you'll be able to find that, and it'll show you activities allowed, cash management, period of performance or procurement, yes, no, yes, meaning the auditor is going to test the compliance of this, and no, the auditor will not. So then it gives more details about how the auditor will test certain compliance requirements. And this is just a good way to kind of have a cheat sheet for what is the auditor going to come in and test and evaluate when they test this major program. So I think it's good to try to familiarize yourself with that as you get ready for that. I think an important distinction is it shows what the auditor is going to test, but not necessarily what is or isn't applicable to each grant. So just because it says, no, the auditor is not going to test this, maybe equipment, real property management, as an example, the auditor may not test that, but if that compliance requirement is in your grant agreement, that does mean that you need to adhere to those requirements still. So again, it's an answer to the test of the single audit, not necessarily your individual grant compliance. HRSA or other OIG, other agencies may come audit you at a different level than in the financial statement or single audit. Part 6 of the compliance supplement is also a really good guide. It goes over common internal controls and suggestions around entity-wide controls, as well as internal controls over compliance requirements. So Darshana mentioned the importance of policies. If you don't have good policies on internal controls over compliance for activities allowed or cash management or procurement, Part 6 of this compliance supplement gives you a lot of really good guides that you can go through and work through as well. If you want to go to the next slide, I've got a couple slides here of common single audit findings. I'll go through this a little quickly, but I think you can take it as a takeaway to use kind of in preparation maybe for a single audit. I'm going to highlight a few of the quick common ones. On activities allowed and unallowed, I'd say payroll. In my experience in single audits, payroll is oftentimes where we have the most issues or findings in this area. So don't use budgeted amounts. You need to make sure you're using actual, so time and effort reporting on if you're charging salaries and wages to federal grants. You need to have management reviewing the time allocations of that payroll and making sure that we're not just saying, okay, we budgeted 25% of this person, so we're just going to take 25% of their salary every payroll period. That may be the right answer, but you need to make sure that they actually worked 25% of their time, and that there's actual time and effort reporting, and it's not just budgeted amounts. Darshan, if you want to go to the next slide. Period of performance is another area where sometimes I see issues. So if this is a June 30 grant year end, maybe you're charging salary and you have a pay period that the first week of the pay period is the last week of the year, and the other pay period is the first week of the beginning of the year. Really only 1 week, kind of that last week of June, is allowable since the period of performance ends at the end of June. So you need to make sure you have good cutoff on expenditures around salary, certainly around payroll expenditures, normal accrual basis accounting as well. But I do see issues there. In procurement, suspension, and debarment, probably the most common audit finding I see as of lately is in procurement or suspension. So inadequate procurement policies. Failure to obtain the right bids. So if you need 3 bids from sources, or if you need to actually go out and do a formal RFP, et cetera. Suspension and debarment. So any vendor that you use for federal grants, you need to have documentation that you've actually checked that they're not suspended and debarred on the SAM.gov list. So not just doing that, but having documentation that you can provide to the auditors that you have done it, maybe having a policy about who checks that, how often they check it, is all going to be important. And if you don't have that, it can lead to single audit findings. Those are probably the most key and common findings that I see in single audits. I've got a couple other areas where, have a few other common items mentioned, but for the sake of time, I think we can kind of go to the last slide here, Darshana. I kind of want to just recap a little bit of what we talked about today. So kind of 6 key takeaways I think that I want to have for everybody here today. First, understand the RHTP regulations. You want to know what you're signing up for. Like Darshana mentioned, we don't want to just throw a bunch of things, on the window and see what sticks as far as what we're applying for. Make sure it aligns with our strategic plan. We understand the regulations that we're signing up for, et cetera. 2, develop a grant compliance matrix. So a roadmap that includes every requirement, report due dates, when approvals need to occur, what are our cost limitations, making sure that you've assigned an owner within your organization to each step that can implement this system. So really need to identify the key individuals, have regular recurring meetings to track this progress. Update grant policies and procedures. Darshana talked about a lot of those. I didn't hit on it as much in the single audit, but I will tell you, policies and procedures are probably the second most important thing in a single audit, outside of just making sure you've spent the money appropriately. Your auditors will look at your policies and procedures and make sure that that's how you've accounted for that funding. 4, maintain accurate records. If you don't have accurate records, you can't prove how you spent the funding or why you did certain things. If there's budget amendments, make sure you get the proper approvals from your agencies and have that documentation, et cetera. Focus on the measurable outcomes. So, connect every dollar that you spent. That's going to make your budget to actual analysis easier. You're going to be able to connect your initiatives to your spending and to your outcomes. Your quarterly reporting is going to be better. Your annual reporting is going to be stronger. And overall, your compliance is just going to be a lot easier for everybody as well. And then lastly, really focus on or stay informed on updates. So continue to review regulations and guidance on a continual basis. I did a lot of effort around provider relief funds several years back when that came out and was released by HRSA. FAQs and new guidance was coming every day, every week, every month. This may be a little different, but it is a very quick funding initiative that the government's throwing out there. So I anticipate guidance will change over time, and you need to have somebody that's responsible for making sure that they're up to date on what the current guidance is, not what the guidance was 2 months ago. So if you can do all this, I think you're setting your organization up well for success to ensure you guys earn and keep these rural transformation dollars. So I think that's all we have prepared for today. Adam, if we've gotten any questions that we can help answer, our contact information is here on this slide as well if there's questions after the webinar also. Thank you.
Yeah, sure, no problem. And thank you guys so much, both Ryan and Darshana. Really appreciate it. I learned a ton today through this webinar. Wanted to kind of jump in and just ask a couple of quick questions, a couple that have come through in the chat. What advice do you give hospitals? What's the best thing to do if were able to do one thing to position themselves for these rural health transformation funds? What would you recommend?
I can go first, Ryan, and then you can add. I would say read the initiatives and see if any of your programs really match, then go behind that money. Otherwise, if there's no alignment, just don't chase the dollars because they're out there.
Yeah, I would agree. If you have a current strategic plan, reviewing that in detail, making sure whatever you're going to apply for aligns with that. I think if you just, like I kind of said, just throwing things out a window and seeing what sticks, if you're going after funding that doesn't align with your strategic plan, you're not going to be able to kind of meet their long-term initiatives that they have for these programs, and you're going to be hurt in that. So it's long term, you may want the current funding, but long term, it's probably going to hurt your organization if you're not, if it doesn't align with what you're doing.
Okay. Another question that's come in, and folks, please feel free to enter any further questions into the chat. Another question that's come in is, how can hospitals best assess whether their current projects or priorities align with what the state is funding? So similar question, but how should hospitals do an assessment of what they're doing and how it aligns with what the state may be putting forward?
And I think I mentioned this earlier, is reading through that application, right? Because what every state has done is said, what is their outcome measurement for those initiatives that they have listed? So reading through those and understanding the measurement of what is the outcome that the state is intending to achieve with this initiative. Does your program support those outcomes? Can you provide data for that? If you have to change the way you're doing your program to fit that, then it's not the right program, right? But if your program already has that information, then I would say that's how you would assess that you're a right fit for that program or initiative.
Thanks, Oshana. And then another question that's come in, again, and folks, please feel free to enter any other further questions in the chat, is talking about the single audit is, will receiving RHTP funding automatically trigger the single audit for your organization? And how should our organizations be preparing for that? And I think Ryan talked about this a little bit, but if you could go into a little bit more detail, maybe.
Yeah, it will not automatically initiate a single audit. So it is going to be based off not, so if you get an award for $5 million, but you don't actually, in your fiscal year, you only spend 750,000. So you only have 750,000 of those expenditures, you would not have a single audit in that fiscal year. However, if you did expend over $1 million in your fiscal year, you would have a single audit. Additionally, if you're an organization that receives multiple federal awards, it's actually the accumulation of all federal expenditures. If that's over $1 million, then you would have a single audit as well. So it's kind of two answers there, either accumulation of all federal expenditures over $1 million, or if you only received the RHTP funding, it's kind of specific to that award and did you expend over $1 million? I think the other part of that question was kind of what to do to prepare now. We talked a lot about policies and procedures, making sure those are up to date, talking with your accounting firm, or making sure that they're aware that you may have a single audit, maybe talking with them about policies and procedures to make sure what you have or what you don't have, getting assistance on getting that information updated would be good. And then just generally making sure you understand the compliance requirements that Darshana went through for what you're applying for. That's going to really help you understand how to then comply in the single audit if you really understand the compliance requirements that you're kind of attesting to in that grant agreement. You have the general ledger capabilities and the internal accounting structure to then track and monitor how you're spending that funding. I think you'll be successful.
Awesome. Thank you guys so much. I really appreciate it. And really want to thank everybody who's joined us for today's webinar in particular. We're coming up on time right now. And just really, again, want to express our thanks and gratitude for Ryan and Darshana for leading a great session today. And thank you all for joining us. You can scan the QR code that's on your screen right now to see all of MHA's educational programming. Our Post-Acute Care Summit is coming up in person this Thursday at 9 a.m. with a 8:30 a.m. breakfast. And also, I would also promote our Workforce Summit that's coming up in July. We have a number of other events that are hot topics webinars that are also coming up. So please check out our education webpage through the QR code here for more information. And we'd love to be able to have you join us at future events as well. So thank you all so much for joining us today, and we'll talk to you all soon.
Thank you all.